What if I told you that some of the most common pills sitting in your medicine cabinet right now could quietly be increasing your risk of a heart attack or stroke after the age of 60? I know that sounds alarming, but this is a conversation more seniors need to hear, because many of these medications are not rare, exotic drugs. They are the same pills millions of people take every day for pain, colds, sleep, or blood sugar. And according to cardiologist Dr. Melanie Sanders, some of these medications can put extra strain on the heart when they are used incorrectly, taken too often, or combined with other medications. Now, before we go any further, I want to make something very clear. The goal of this conversation is not to scare you into throwing away your prescriptions. Many of these medications are helpful and even life-saving when used properly. But Dr. Melanie Sanders often reminds her patients that understanding how these drugs affect the heart becomes much more important as we get older. After the age of 60, the cardiovascular system becomes more sensitive to certain medications, and the body does not process drugs the same way it did decades earlier. Let me ask you something for a moment. Have you ever taken a pill for joint pain, a cold medicine for congestion, or a sleep aid at night without thinking twice about it? Most people have. It is very common. But what many seniors do not realize is that some of these everyday medications can raise blood pressure, strain the heart, or interfere with normal circulation. Over time, those effects can increase the risk of serious cardiovascular problems. The first type of pill Dr. Melanie Sanders often warns about is common pain relievers known as NSAIDs. These include medications like ibuprofen, naproxen, and similar anti-inflammatory drugs that people often take for arthritis, back pain, or headaches. For many people, these pills seem harmless because they are sold over the counter. But research has shown that regular use of certain anti-inflammatory pain medications can increase the risk of heart attack and stroke, particularly in older adults. The reason is that these drugs can cause the body to retain fluid and raise blood pressure. When blood pressure rises, the heart has to work harder to pump blood through the body. Over time, that added strain can contribute to cardiovascular problems. Dr. Melanie Sanders often explains that the risk becomes higher when these medications are taken frequently, at high doses, or for long periods without medical supervision. Another group of medications that can create hidden heart stress are cold and flu pills containing decongestants. Many popular cold medicines include ingredients designed to shrink swollen blood vessels in the nose so that breathing becomes easier. While that may relieve congestion, those same ingredients can also constrict blood vessels throughout the body. When blood vessels tighten, blood pressure can spike. According to Dr. Melanie Sanders, this effect can be especially concerning for seniors who already have high blood pressure or heart disease. A simple cold medicine may seem harmless, but in some cases, it can raise heart rate and blood pressure enough to increase cardiovascular risk. That is why cardiologists often recommend that older adults carefully read labels and speak with a pharmacist or doctor before taking decongestant medications. The third category of pills that can affect heart health involves stimulant-based medications. These drugs are sometimes prescribed for conditions such as attention disorders or severe fatigue. They work by stimulating the nervous system, which can increase alertness and energy levels. However, that stimulation also increases heart rate and blood pressure. Dr. Melanie Sanders points out that while these medications can be appropriate for certain patients, they need to be used with caution in older adults. The aging heart is not always able to tolerate prolonged stimulation the same way a younger heart can. Over time, this increased workload can raise the risk of irregular heart rhythms or other cardiovascular complications. Another group of medications that cardiologists monitor closely are certain older diabetes drugs. Some medications that were once widely prescribed to control blood sugar have been linked in research to a higher risk of heart-related problems. Because people with diabetes already face an increased risk of heart disease, doctors today are often more careful about which medications they recommend. Dr. Melanie Sanders frequently reminds patients that managing diabetes is not just about controlling blood sugar. It is also about protecting the heart. That is why modern treatment plans often include medications that support both blood sugar control and cardiovascular health. There is also another category of medication that deserves mention, and that involves certain drugs used in cancer treatment. Some chemotherapy medications can affect the heart muscle and weaken its ability to pump effectively. Doctors call this cardiotoxicity. While these medications are extremely important for treating cancer, they require careful monitoring of heart function during treatment. Dr. Melanie Sanders explains that advances in modern medicine have made it much easier for doctors to watch for these effects and protect heart health during treatment. Cardiologists and oncologists now often work together to monitor patients closely so that both cancer and cardiovascular health can be managed safely. Now, hearing all of this might make you wonder if medications are dangerous. The truth is that medications save lives every single day. But what Dr. Melanie Sanders emphasizes is that awareness is the key to safety. Many problems occur not because the medication itself is harmful, but because people take it without realizing how it might interact with other drugs or existing health conditions. After the age of 60, the body processes medications more slowly. The liver and kidneys may not clear drugs as efficiently as they once did. As a result, medications can stay in the system longer and have stronger effects. That is one of the reasons seniors are more sensitive to certain drugs. Another factor is that many older adults take multiple medications at the same time. Doctors call this polypharmacy. When several medications are taken together, their effects can combine in unexpected ways. A pain pill, a cold medicine, and a blood pressure drug might each seem harmless on their own, but together they can create additional stress on the heart. Dr. Melanie Sanders often encourages patients to bring all of their medications, including over-the-counter pills and supplements, to their doctor appointments. This allows the healthcare provider to review everything together and make sure there are no dangerous interactions. There is also a simple habit that can make a big difference for heart safety. Always read medication labels carefully. Many people skip this step because they assume a familiar brand is completely safe. But ingredients can change, and certain products may contain hidden stimulants or decongestants that affect blood pressure. Another smart step is to speak with a pharmacist before starting any new medication. Pharmacists are trained to identify drug interactions and can quickly tell you whether a certain pill may affect your heart or interact with your existing prescriptions. Dr. Melanie Sanders often reminds people that protecting the heart is not only about diet and exercise, it is also about being mindful of what we put into our bodies, including medications that seem routine or harmless. If you are over 60, this is a good time to take a moment and review the medications you use regularly. Ask your doctor if they are still the best options for your health today. Medical science evolves quickly, and newer medications are often safer and more effective than older ones. It is also important to remember that never stopping a medication suddenly without medical advice is essential. Some drugs need to be reduced gradually or replaced with safer alternatives. That decision should always be made together with a healthcare professional. The most important message Dr. Melanie Sanders wants people to understand is that knowledge gives you power. When you understand how medications affect your heart, you can make smarter decisions about your health. Small adjustments in medication choices can sometimes make a big difference in long-term cardiovascular safety. If you found this information helpful, consider sharing it with someone you care about. Many seniors are taking medications every day without realizing how they might impact heart health. A simple conversation could help someone avoid a serious health problem in the future. And remember, your heart works for you every second of every day. Taking the time to protect it is one of the most important investments you can make in your health and your future.